The wound care program here is a comprehensive management program. The folks in our group have been in wound care for a long time, the majority of us more than 20 years.
This is a really dynamic place to have wound care with people that spend the majority of their time just treating patients with wounds.
Normally, healthy people would heal wounds very easily, but there are some people, for certain reasons, have trouble healing them. We see patients come in and they're kind of at a loss of what to do, but they may have just not had the right kind of treatment.
Given the complexity of our patient population, we're often referred individuals that have been through other centers, seen at other hospitals, other institutions. Some of these patients come from out of state. We provide the highest level of care, and whatever they may require, those resources are going to be available to us here.
We welcome the patients into the clinic. We set them up in the room, get their history as to why they're here. We'll look at the wound, do a gentle cleaning, take some pictures and measurements so we can see the progression.
And then the nurse and the physician work together to make sure that we're cleaning the wound. And then we use tissue-based products or collagen to try and facilitate cell growth. And then the nurse is responsible for dressing the wound and educating the patient and helping them understand the stages of the wound and how we manage it so that they're reassured that we're heading in the right direction.
We have an amazing team of nurses and techs and front staff and physical therapists. We have some of the best providers. Our providers do amazing things, and we're always working hand in hand with each other. One of our providers is a surgical podiatrist, so we'll see a lot of foot ulcers and we can put on casts.
For people with diabetes, when they develop a pressure ulcer on the bottom of their foot, you have to de-weigh the pressure area. It's shown that with total contact casting, the majority of diabetic foot ulcers can be healed within a month.
We end up seeing patients who failed therapy and do extremely well with this casting technique.
Because people with diabetes can lose sensation in their feet, they're at very high risk for developing pressure ulcers or wounds. So we combine a program of cleaning and debriding the wounds with wound care products and oftentimes hyperbaric oxygen, which is used to help improve blood flow to wounds.
As a plastic and reconstructive surgeon, surgeries really run the spectrum of wound care. I'm often seeing patients that have a significant medical history. I'm able to lean on or rely on a true multidisciplinary team here at Southwestern to help with the care of these patients. We have all of the pieces of the puzzle, so to speak, in order to put that picture together.
Because we have all of the available subspecialties right here in one location, that comprehensive team approach, I think, really produces the best outcomes.
It's just really rewarding to be able to see people come in with these open wounds and watch them through the process of healing, and then be able to leave the clinic healed up with brand new skin.
We're working together day by day to be better and to provide the best care for our patients.
You'll see someone who's had a wound open for 6 months, and with a month of appropriate treatment, we can get that wound closed. That's rewarding for the patients, but it's also really rewarding for us.
Being able to treat people who are fearful that they're going to lose their leg and being able to heal their wound, it's a cause for celebration.